Ms. Kathy Cavaney.
My name is Kathy Keaveney. Thank you for the opportunity to speak. South Korea, Japan, Australia, New Zealand, India, Switzerland, Thailand, Indonesia, the Philippines, the United Arab Emirates, 4 countries of the United Kingdom, 27 countries of the European Union, Canada, and the World Health Organization have all approved the Novavax vaccine. A vaccine developed by a company in Maryland funded with $1.8 billion of United States citizens' hard-earned taxpayer money, and yet it has still not been approved for the American citizens who paid for it. Why not? Why in the United States, bastion of freedom and personal choice, are Americans served up only one type of vaccine option, mRNA, while the rest of the world gets choice? When Operation Warp Speed was initiated, it funded 7 companies. Practically speaking, we are now down to 2, Moderna and Pfizer, and both are mRNA platforms. The FDA's response to the delay in approving Novavax has seemingly been 2 issues: the amount of trial data to be reviewed and the need to inspect Novavax's manufacturing. I question both. Your contemporaries on review boards across the world have managed to review Novavax's trial and manufacturing data and expeditiously approved this vaccine. What is it about this data that is somehow more onerous for the FDA to interpret? A Wall Street Journal article attributed the delay to manufacturing inspections, quoting a source as saying, pandemic safety protocols made it more difficult for FDA inspectors to get to Novavax's overseas manufacturing sites. I fail to see why, in the midst of a global pandemic, with millions dying, the FDA couldn't put on a mask, get on a military plane, and fly to India to inspect Novavax's one manufacturing site. Certainly many inspectors from other countries did. Throughout the last 2 years, I've learned a great deal about why others want Novavax. I've learned that there are American citizens who, after 2 years, still haven't left their homes because they have medical reasons that won't allow them to take mRNA vaccines. I've learned that many Americans have been fired or quit their jobs rather than be forced to take the one type of vaccine that their employers mandate. I've learned that many have had adverse reactions to mRNA vaccines. At this same meeting 2 months ago, this very committee heard from American citizens, many in tears, who described their adverse reactions to mRNA and pleaded with you to help. I've learned that Americans with dual citizenship have resorted to going to other countries in hopes of receiving the Novavax vaccine where it has been approved. Americans paying to go to other countries to get a vaccine that's headquartered 20 minutes from your office. I've learned that while we deny our own citizens the Novavax vaccine, we allow citizens from other countries who have been vaccinated with Novavax there to freely travel here. I've learned that Americans who want Novavax choice are not vaccine hesitant or anti-vax or afraid or whatever other terms the media likes to use to marginalize us. We're simply informed Americans who believe that this is a better, safer vaccine, and we want what our $1.8 billion paid for. And where is America's leadership on this? Full disclosure, I voted for President Biden, but I don't understand how a country can invoke the Defense Production Act to manufacture and import baby formula, yet in a time when millions are dying, can't figure out how to get Novavax from India, or better yet, help them produce it in the United States. A year ago, President Biden was quoted as saying, the problem right now is that we have to make sure we have other vaccines like Novavax and others coming on. Also a year ago, Ashish, Biden's COVID czar, had this to say about Novavax. Quote, I realize that the Novavax vaccine results won't get the same attention as we heard from Moderna, Pfizer, and Johnson & Johnson, but for vaccinating the world, this is huge. Very, very good news. Novavax is essential to vaccinating the globe. The fact that Novavax has 90% efficacy is awesome. And yet, still nothing. Awesome news for the globe, just not for the United States. An emergency use authorization based on today's meeting will certainly be a step in the right direction, but it would be largely meaningless if you do not follow quickly behind that with an EUA to allow people to choose Novavax as a booster to the Moderna and Pfizer mRNA vaccines they have already received. A week from now, on June 14th and 15th, the same committee will review Moderna and Pfizer's applications for immunizing 6-month to 4-year-old children. For some Byzantine reason, Novavax can't advertise in any of the countries where it's already been approved until it's approved by the FDA. Without advertising or marketing or media coverage or governmental promotion, parents aren't informed. Many don't know that elsewhere in the world, vaccine choice exists, and it should exist for they and their children. Parents don't have the time or energy to sit around and read up on all this, and you know it. Instead, they will rely on your recommendations. Because they are scared and wanting to protect their kids, they will rush to vaccinate our most vulnerable with the only option you've allowed them. You won't put the brakes on this, but you should, until they're given a choice. Parents should be able to make informed decisions about their children's health, and you should inform them. Which brings me to the media. You are complicit. I'm a mother, not an investigative reporter. I'm tired of this battle and have 8th grade math homework to focus on. Do your job. Ask questions. Quit regurgitating what you were fed. I challenge you to verify or discount every detail of what I've said here today. You have 1 week until this committee meets again to determine approval for mRNA in infants and toddlers. Again, parents should be informed. You should inform them. Members of this committee, you were charged with evaluating the benefits of this vaccine, but you also have the awesome responsibility of ensuring American citizens continue to have freedom of choice. Thank you for allowing this mom for Novavax to speak.